Hi friends, this is Iqra. Welcome to my channel. In this video I will guide you some preventative and precautionary measures to avoid heart attack. So let's start. 1. Eat a healthy and balanced diet. A low-fat, high-fiber diet is recommended, which should include plenty of fresh fruit and vegetables and whole grains. You should limit the amount of salt you eat to no more than 6 grams a day, as too much salt will increase your blood pressure. 6 grams of salt is about 1 teaspoonful. There are two types of fat, saturated and unsaturated. You should avoid food containing saturated fats, because these will increase the levels of bad cholesterol in your blood. 2. Be more physically active. Combining a healthy diet with regular exercise is the best way of maintaining a healthy weight. Having a healthy weight reduces your chances of developing high blood pressure. Regular exercise will make your heart and blood circulatory system more efficient, lower your cholesterol level, and also keep your blood pressure at a healthy level. 3. Keep to a healthy weight. A GP or practice nurse can tell you what your ideal weight is in relation to your height and build. Alternatively, find out what your body mass index (BMI) is by using our BMI calculator. 4. Give up smoking. If you smoke, giving up will reduce your risk of developing chronic heart disease. Smoking is a major risk factor for developing atherosclerosis. It also causes the majority of cases of coronary thrombosis in people under the age of 50. 5. Reduce your alcohol consumption. If you drink, do not exceed the maximum recommended limits. Men and women are advised not to regularly drink more than 14 units a week. Always avoid binge drinking, as this increases the risk of a heart attack. 6. Keep your blood pressure under control. You can keep your blood pressure under control by eating a healthy diet low in saturated fat, exercising regularly and, if needed, taking medicine to lower your blood pressure. 7. Keep your diabetes under control. You have a greater chance of developing CHD if you have diabetes. Being physically active and controlling your weight and blood pressure will help manage your blood sugar level. 8. Take any prescribed medicine. If you have chronic heart disease, you may be prescribed medicine to help relieve your symptoms and stop further problems developing. If you do not have chronic heart disease but have high cholesterol, high blood pressure or a history of family heart disease, your doctor may prescribe medicine to prevent your developing heart-related problems. Thanks for watching my video. Don't forget to like, share and subscribe my channel.